Hello YouTube family, it's your friend Camille Maxwell-Nery again. I am just today want to give a general overview of Doxorubicin, Methotrexate, Sucralfate, vancomycin, and gentamicin. This is just basically my notes for reinforcement, and I'm sharing them with you, hoping that it will be beneficial for your own studies. You be free to utilize this information if you find that it is beneficial to you. So, Doxorubicin, brand name is andriamycin. The indication is for various cancers such as breast, ovarian, bladder, leukemia, lymphoma, and so on. Some common side effects that we should monitor for include nausea, vomiting, alopecia, hair loss, mucositis, and fatigue. And I will, as I'm going through the slide, go into a little bit more detail with each slides, add a little bit more reinforcement. Adverse effects include cardiotoxicity, such as heart failure, arrhythmias, bone marrow suppression, secondary malignancies, such as severe tissue damage if extravasation occur. This typically happen during IV infusion, so because of the toxicity and the velocity of the medication. Nursing implementation, we are to monitor cardiac function by use of echocardiogram or ECG as well. Use central venous access to avoid extravasation. As I mentioned before, you don't want to put this in the peripheral line. Monitor CBC and liver function tests. Ensure hydration to prevent nephrotoxicity. Some patient teaching include urine may turn red, orange temporarily. So you want to notify the patient so that they're not alarmed. Report signs of infection or heart issues, swelling, fatigue, chest pain. Avoid crowd or sick people due to due to this can cause immunosuppression. Hair likely will regrow after treatment, because due to alopecia, you might want to inform the patient that the hair will likely to regrow after treatment ends. Then some additional reinforcement note, as I mentioned before, doxorubicin, also referred to as adriamycin, is a cytotoxic anthracycline antibiotic used in cancer chemotherapy. It works by intercalating DNA, inhibiting topoisomerase ACE2, and generating free radicals that damage cells. Adverse effects, common adverse effects of doxorubicin is alopecia, which is reversible, and nausea, vomiting, moderate to high hematogenic potential, stomatitis, and mucositis. Myelosuppression is neutropenia, thrombocytopenia, anemia. So red-orange discoloration of urine is benign and is expected, so we want to teach a patient pertaining to these things, as well as educating them on the myelosuppression, neutropenia, thrombocytopenia, and anemia, for example. Some serious adverse effects include cardiotoxicity. In the acute, you have arrhythmias, EKG changes, which is rare, and then chronic dose depends on cardiomyopathy, leading to heart failure. Lifetime cumulative dose should not exceed 450 to 550 milligram. So lifetime cumulative dose should not exceed 450 to 550 milligram. Extravasation injury due to the vesicant is severe local tissue necrosis if leakage occurs. So it can be very severe. Secondary malignancy, example leukemia, Nursing implementation before administration, obtain baseline ECG, echocardiograms, or a mega scan. Verify cumulative dose and do not exceed, as I mentioned before, 550 milligram. Assess liver and renal functions. You will do some labs, check CBC. During the administration, if IV only, give slowly over 15 to 60 minutes. If IV only, give slowly over 15 to 60 minutes. Via central line is preferred. If using a peripheral line, ensure patency before and during infusion. Monitor for signs of extravasation. As I mentioned, is a vesicant, so it can be very painful. So it may cause one monitor for pain, redness, and swelling at the site. If extravasation occurs, stop the infusion immediately. Apply a cold compress. Administer Doxorubicin, Tortect, T-O-T-E-C-T, if it's available. Extravasation antidote. After administration, you want to monitor for delayed cardiotoxicity. Week to monitor. This may take weeks to months for you to see improvement. And then infection or bleeding due to myelosuppression. We want to monitor for these things. And then the antidote for is the Doxorubicin, if it's available. Educate on urine discoloration, as I mentioned before, orange-red for the first 1 to 2 days. Definitely cardiac monitoring for doxorubicin. Monitor parameter, ejection fraction. Use echo and mega scan. Perform baseline, then periodical, especially before cumulative dose greater than 300 milligram. Maintain monitor for any fatigue, dyspnea, edema, cough, signs of congestive heart failure. Monitor changes on ECG or new arrhythmias. Cardioprotective agent, doxorubicin, Zenocar may be used for cardioprotection in patient nearing cumulative dose limit, which is the 550. So doxorubicin, Zenocard may be used for cardioprotection in patient nearing cumulative dose limit. And some patient teaching you want to teach a patient what to report immediately, such as chest pain, palpitation or shortness of breath, fevers or chills, signs of infection, unusual bleeding or bruising, oral sores or pain, redness, swelling at the injection site. And then just some education point. Of course, we know hair loss is common and its temper is going to grow back, so we want to prepare the patient. As I mentioned before, the urine may turn red or orange for the first 1 to 2 days. This is harmless, so you want to alarm the patient, educate the patient so they are aware of this. Avoid pregnancy during and for 6 months after treatment because it's a teratogenic. Use good oral hygiene, soft toothbrush to avoid mucositis and bleeding. Stay away from crowd, sick people to reduce infection due to immunosuppression. So indication and side effects. Methotrexate. The brand name is Taraxol Romatrex. The indication is for cancer, leukemia, lymphoma, autoimmune disease such as rheumatoid arthritis and psoriasis. It's also used for ectopic pregnancy off-label. Some common side effects are nausea, vomiting, mouth sore, dizziness, headache, photosensitivity, and some common adverse effects include hepatotoxicity, bone marrow suppression, pulmonary fibrosis. It's also nephrotoxic. Some nursing implementation, you want to monitor CBC, liver and kidney function, ensure adequate hydration, Administer folic acid to reduce the toxicity. And you want to use with caution in renal patient because it is nephrotoxic. Some patient teaching, take folic acid as prescribed. Avoid alcohol and NSAID. And you want to use some protection as well due to photosensitivity. And report signs of liver dysfunction such as yellowing of the eye, skin, dark urine, etc. Some additional notes that I want to add to methotrexate is a folic acid antagonist, as I mentioned, that inhibit dihydrofolate reducase enzyme, leading to reduced DNA synthesis. It has an anti-neoplastic, immunosuppressive, and anti-inflammatory effect. Is used for cancer in high dose, leukemia, especially acute lymphoblastic leukemia, and then lymphoma, breast cancer, head and neck cancer, choriocarcinoma, and gestational trophoblastic neoplasia, osteosarcoma. Autoimmune and inflammatory disease in low dose is also used for rheumatoid arthritis. It's one of the cornerstone for doormats, and then it's also used on psoriasis in moderate and to severe plaque psoriasis. Psoriatic arthritis, systemic lupus erythematosus is also used for that off-label. In Crohn's disease as well off-label. Juvenile idiopathic arthritis and ectopic pregnancy, as I mentioned previous. So non-surgical management of unruptured ectopic pregnancy is utilized for that as well. So some serious or additional adverse reaction, hematologic is myelosuppression, severe case, and then pancytopenia, especially renal impairment or overdose. Hepatotoxicity, liver fibrosis or psoriasis with long-term use. Routine liver function test monitoring is required. For pulmonary, methotrexate induced pneumonitis. So non-productive cough, fever, dyspnea can be acute and life-threatening. So definitely monitor for these things as well, because it can induce the pneumonitis. Then for renal nephrotoxicity, under renal we have nephrotoxicity in high dose methotrexate, especially if not well hydrated. So you want to encourage the patient to increase fluid. And then we want to monitor for infection because it's immunosuppressant, increased risk of opportunistic infection. And then reactivation of latent TB or hepatitis B. So definitely want to teach these things. And then tetrogenicity for pregnancy is contraindicated, and in breastfeeding as well. It can cause fetal death and congenital malformation. So important to inform the client pertaining to this. And then supplement, also teach supplement with folic acid. About 1 milligram a day is recommended. They can use folinic acid, leucovorin to reduce GI and hematolytic toxicity. And then we want to monitor the CBC, the liver function test, renal function every 1 to 3 months. We want to do chest x-ray for baseline and pregnancy test before starting in women of childbearing age. So Sucralfate, brand name is Carafate. Indication is duodenal ulcer, gastric ulcer, GERD, off-label. Some common side effect is constipation, dry mouth, indigestion. Some adverse effect include is very rare but potential aluminum toxicity in renal failure. So want to use caution with patients who have renal failure. And some nursing implementation, you want to give it on empty stomach 1 hour before meals and at bedtime. Avoid giving with other oral medication, may affect absorption. Shake suspension well before use. And then some patient teaching, take exactly as prescribed. Do not crush or chew this tablet. Increase fluid and fiber intake to prevent constipation and separate from other meds by at least 2 hours. Vancomycin, brand name is vancomycin. The indication is a serious gram-positive infection. Is given for serious gram-positive infections such as MRSA, C. diff, and C. diff. So also bone, joint, bloodstream infection as well. Bone, joint, and bloodstream infection. Some side effect is nausea, hypotension during infusion, rash. So you want to monitor for these side effects. Some adverse effect is nephrotoxicity, autotoxicity, and vancomycin can also cause red man syndrome, most especially rapid infusion. Nursing implementation, administer slowly at least over 60 minutes to prevent red man syndrome. So you want to administer the vancomycin slowly at least over 60 minutes. Monitor trough levels, monitor renal function, such as BUN and creatinine. Assess for hearing changes, that's indication of toxicity. And then patient teaching to report any hearing loss, tinnitus, complete full course of event, complete the full course even if they are feeling better and they want to stay hydrated. Want to notify nurse if rash or flushing occurs. And then for the gentamicin, brand name is garamicin. The indication is for severe gram negative bacterial infection, used for sepsis, respiratory, and urinary tract infection. Some side effect is nausea, vomiting, injection irritation at the injection site. Some adverse effects is autotoxicity, nephrotoxicity, neuromuscular blockage, which is rare. Nursing implementation, monitor peak and trough level, assess renal function before and during therapy, ensure adequate hydration, avoid concurrent nephrotoxic or autotoxic drugs. And then patient teaching, report hearing or balance changes, avoid NSAIDs unless directed by the healthcare provider, and they want to take them to take it exactly as prescribed, and then stay hydrated. So theophylline use, side effect, toxicity, monitoring, patient instruction is going to be on the next topic. So theophylline is a methylxanthine bronchodilator. Is used primarily for respiratory disease. Although it's less commonly used today due to its narrow therapeutic window and toxicity risk, it still has indication in specific cases. So approval indication of theophylline is for chronic asthma, used as an adjunct therapy for persistent asthma, particularly when inhaled corticosteroids and bronchodilator are insufficient. Not at first line, it's not at first line use, but is used in the indication of chronic asthma. And then for chronic obstructive pulmonary disease, COPD, used for symptoms control and reduction of exacerbation in selected patients. Consideration in patient not responding adequately to acting bronchodilator or corticosteroids also. And then apnea of prematurity in neonates. This is also approved indication. Related compound such as aminophylline, a prodrug of theophylline, is sometimes used. Stimulates respiratory drive in premature infants. So the aminophylline is a prodrug of theophylline and is sometimes used because it stimulates the respiratory drive in premature infant. Off-label historical use for this drug is congestive heart failure for theophylline. Historical use not standard anymore. So and then also another off-label is chain stroke respiration. This is experimental and historical, so for chain stroke respiration. And then central sleep apnea is rare but limited efficacy are indicated. And then mechanism of action is, as I mentioned, is a bronchodilator. By inhibiting phosphodiesterase, it increases intracellular CAMP, adenosine receptor antagonist, contribute to CNS and cardiac stimulation. Anti-inflammatory effect is modest. Clinical consideration due to risk of toxicity and drug interaction, theophylline is not preferred as first-line therapy. Newer agents are in place, such long-acting beta agonists, muscarinic antagonists, and inhaled corticosteroids are safer and more effective. So theophylline carries a serious toxicity risk, especially when blood level rise above the therapeutic range. It has a narrow therapeutic index, meaning the difference between an effective dose and a toxic dose is small. So toxicity can occur even with small increases in doses or changes in metabolism. So range, typically therapeutic plasma concentration is 10 to 20 for the range for theophylline, 10 to 20 microgram per milliliter. And then toxic effect often occur if it's greater than 20 microgram per milliliter, and this can be life-threatening at 40 milligram per milliliter. So some causes of toxicity is overdose, acute or chronic ingestion of high doses, and then drug interaction, especially with medication that inhibit liver enzymes such as ciprofloxacin and erythromycin. And then it has liver dysfunction, impair metabolism of theophylline. So if there's liver function, it's going to impair the metabolism of the theophylline. Age extremes in this case, infant and elderly, so metabolize theophylline differently. So we want to have consideration for this particular age group. Febrile illness or smoking cessation, this can affect the metabolism. So we want to take those into consideration as well. Symptoms of theophylline toxicity for mild to moderate toxicity include nausea, vomiting, diarrhea, restlessness, insomnia, tremors. And then for severe toxicity, we want to monitor for seizure, may occur without warning, okay? And then cardiac arrhythmia, such as supraventricular tachycardia and ventricular fibrillation. Hypotension, hyperglycemia, hypokalemia, metabolic acidosis. These are severe toxicity. So some management, you want to stop the theophylline if we indicate any of these toxicities happening, or for supportive care such as IV fluid, antiemetics, and seizure management. You want to utilize activated charcoal, especially in the acute overdose or multiple dose may be used. So hemodialysis or charcoal hemoperfusion in severe cases or renal failure. So you want to do hemodialysis or charcoal hemoperfusion in severe cases of renal or severe cases or renal failure. You want to monitor serum theophylline level and electrolytes and ECG. And we mentioned it was 10 to 20. And then for the therapeutic range, and then is life-threatening toxicity if greater than, well, toxic effect occurs at 20, and then can be life-threatening if it's more than 40 microgram. And then so just some clinical notes because of its risk profile and availability of safer alternative like inhaled beta agonists or corticosteroids are available. Theophylline is now less commonly used in clinical practice, particularly in developed country. So just some additional clinical notes to add there as well. The drug interaction and precaution. Theophylline has numerous drug interaction and precaution, largely due to its narrow therapeutic index, as I mentioned before, hepatic and metabolism via cytochrome P450 enzyme, especially CYP1A2 and CYP3A4. These are the cytochrome P450 enzymes. So even small changes in clearance can lead to toxicity or reduced efficacy. Major drug interaction: drug that increase theophylline level inhibit metabolism. So drug that increase theophylline levels and also inhibit metabolism. These can cause toxicity by reducing theophylline clearance. Macrolide antibiotics such as erythromycin and chlorothromycin, quinolones such as ciprofloxacin and anoxacin, the cimetidine H2 blockers, fluvoxamine, SSRI, oral contraceptive, allopurinol, especially in high doses, xylitol or leukotriene modifiers, verapamil, and ditalazam, amiodarone as well. And then drugs that decrease theophylline level, which induce metabolism. These may reduce the efficacy of the drug, such as phenytoin, carbamazepine, phenobarbital, rifampin. So smoking like tobacco induce the CYP1A2 enzyme, and then St. John Wort. Additive toxicity risk includes beta agonists such as albuterol. This increases the risk of hypokalemia and arrhythmia. Caffeine addictive like CNS stimulant and diuretic increased risk of hypokalemia. Fluoroquinolones such as theophylline increase CNS side effects and seizure. Precaution and contraindication include monitoring serum theophylline level regularly. You want to use it in caution in the elderly, the neonates, people with hepatic impairment, cardiac arrhythmia, seizure disorder, and peptic ulcer disease. I want to adjust dose for those with fever greater than 102. That is lasting more than 24 hours. Congestive heart failure, you want to reduce, we want to adjust the dose as well. Liver disease, and for patient who after ceasing from smoking. Is contraindication. So known hypersensitivity to theophylline or related compounds such as caffeine, theobromine, uncontrolled seizure disorders, acute cardiac arrhythmia. You want to monitor theophylline levels. As I mentioned before, the therapeutic range is 10 to 20. Want to monitor for serum levels, especially after changes in dose or interacting drugs. Monitor for signs of toxicity, including nausea, vomiting, tremor, seizures, and arrhythmia. And then monitor electrolyte and ECG in more severe cases. Patient education, recognizing and reporting side effects. As I mentioned before, theophylline is a bronchodilator used to treat asthma, COPD, and other lung conditions by relaxing the airway and improving breathing. It's used for instruction use. Take exactly as prescribed at the same time each day. Do not crush or chew. Extended release tablet unless instructed. Take with food or a full glass of water to reduce stomach upset unless advised otherwise. Do not stop or change the dose without consulting your healthcare provider. Some precaution to teach is to avoid caffeine, coffee, tea, energy drink. These can increase the side effects. Tell your doctor about all medication, vitamins, and herbal supplement. If the patient start or stop smoking, inform the doctor. They want to inform the doctor. It affects how the body handles theophylline. Avoid alcohol. It may increase side effect or interact with other medications. And then recognizing theophylline toxicity. It has a narrow safety margin, so recognizing early signs of toxicity is crucial. You want to report immediately nausea and vomiting, especially if persistent or unexplained nausea and vomiting is occurring. Restlessness and tremors, insomnia, fast irregular heartbeat, palpitation, seizure, confusion or dizziness, headache not relieved with routine measures. And then we want to monitor regular blood tests to measure theophylline levels. Also want to monitor the heart rate, the blood pressure, and breathing symptoms. You want to teach a patient to call the healthcare provider if they miss a dose. And they should take it as soon as they remember. If they miss a dose, take it as soon as they remember. Unless it's almost time for the next dose. And then call the provider if they feel worse or notice worsening breathing symptoms. Have new medication prescribed, including antibiotic or seizure meds. You want to notify the healthcare provider. And then stop smoking, or if they stop smoking or feel ill with fever and so on, they also want to notify the provider. And then if they miss a dose, as I said, take it as soon as they remember, unless it is almost close to the next dose. They don't want to overdose or double dose. So summary best practice, some summary and best practice for us for safe use when we're giving medication. So just the importance of monitoring and adherence. Consistent monitoring and strict adherence to prescribed protocol are essential to ensure patient safety and treatment efficacy. And then patient communication with healthcare provider, effective communication between patient, healthcare provider, facilitate timely intervention and improve overall care. Thank you. Hope this was significant enough to be meaningful for your studies.